Fraser Focus, a fresh perspective beyond the bridge.
Hey everyone, welcome to Fraser Focus, local faces and places here in the Fraser region. I'm Leah Bolton.
And I'm Dean Atwell. On this show, we strive to tell stories that are often overlooked by mainstream media.
On this week's episode, we take a look at the second part of our special series showcasing the Surrey Memorial Hospital's thoracic surgery team and their world-class treatments.
Just hand that star to me and all of that junk, eh? Okay, grab your stapler.
Back in the old days, which was only about a decade ago, thoracic surgery involved large incisions. Now with minimally invasive surgery, the incisions are much tinier and that's less discomfort for the patient, quicker recovery time.
This patient has a collapsed lung, sponge, and she's continuing to leak air from a defect in her lung. So we're gonna make 3 little holes. You can see here, the size of this hole is roughly 1 centimeter.
I think you just nodded.
Yeah, because it's on the left, right? Yeah.
Well, that's a good question. You'd have to do well, where is the sternum?
What we did 10, 20 years ago, you would be surprised to hear that most of those procedures are almost completely abandoned.
Tests in a colonoscopy revealed colorectal cancer, and then as tests progressed, it revealed that cancer in the lungs, lymph nodes were affected, so the journey was quite interesting from there. And that led me to Dr. Ashrafi's office, where he took me on as his patient. In my mind, one of the key parts was that they decided to do surgery, even though I had more than 1 cancer site to be operated on.
Are there any problems overall that you can think of?
No, none whatsoever. There is a bit of a new normal because you have to kind of deal with some of the pieces that are missing from your body, but other than that, no.
In a staged manner, I operated on one side, then after a few weeks of recovery, I was able to operate on the other chest and remove the cancer from the other side as well.
Now open it, and what I want you to do is to come in here and close the lung, close it tight, don't lock it though. Just hold that for a second. When I first got into practice and we did esophagectomies, it was with big cuts, and we kept patients in hospital for upwards of 14 days, sometimes longer. Now we do with small cuts, we can do the surgery in the same or less time, and the patients are in hospital 6-7 days. They go home and they have much less pain. Their return to work is so much more predictable and so much faster.
That's all the Rice Krispies under your skin.
It is.
So that's just air is leaked into the cells there.
Okay.
Yeah.
Okay.
Okay, those are your staples. Before I came, the surgeons would pop in the morning. They'd be gone to the OR for 4 hours and pop up. They have maybe 5-10 minutes between cases. So I can spend all day up here. If patients have questions, family has questions, I can come and talk to them. If the nurses have questions, I'm easily accessible. So it looks like last evening,
yeah, it does.
when you were walking maybe, that you start to get a little bit more of air leaking into the lung.
Success of program depends not only on the skill set of the team, but also on the quality of the equipment.
This is called the pinpoint machine. It allows us to plan for patient outcomes as opposed to guessing patient outcomes. So when we see somebody, we say, we're going to take out your esophagus, and when we put you back together, there's a 5 to 10% chance that you might leak. This allows us to actually understand that risk even higher, especially as we get more and more use out of it, to say, you know what, that risk that I thought was 5 to 10%, it's going to be less than 1%. It got great perfusion. And have you got some more of that Marcaine?
So what we're doing is we're raising funds for $2 million worth of equipment, which is top of the line, state-of-the-art, minimally invasive surgical equipment, which will really put us on the map. We need help. People can make donations in multiple ways, and that will get us to our $2 million target.
So this is a camera that allows us to see, and you can see the inside here. And right up here at the top here, if you can see that, is the abnormality that's causing her grief. She's got some scarring tethering the lung, and that's what's keeping it from reinflating and the hole from sealing. So we're gonna remove that scar.
So how many of those surgeries do you do MIS here?
At Surrey, I would have to say you can almost count on one hand the number of times we do not do an operation by MIS.
I mean, look at how much deformity is, even his hands, he can't move, it's just...
Yeah, he's completely dependent on care. If you come in with a lung cancer, the chances of you having an open surgery here would be very small. The vast majority of them are done with minimally invasive procedures as well. And in the rest of North America, right now, lung resections as an example, and even esophageal resections, maybe 30 to 40% of other centers are offering it in some ways or capacities. And quite literally, the patient has had major lung resection and has a couple of Band-Aids. So we are 20 minutes and done. Before the small holes, that would have taken us a good hour, hour and a half.
We just cut your time by 40 minutes.
Or longer. The other thing that we didn't have to do is we didn't have to do a lot of other anesthetic prep time because we don't have to we're not challenging the patient in the same way physiologically.
Before getting involved with Surrey Memorial and their story, I thought that thoracic surgery only related to patients that had something to do with cancer.
Clearly there's a wider scope here. Coming up on Fraser Focus, we learn more about the growing population and its impacts here in the Fraser region.
We'll be right back.